So, St George's Crypt from its beginnings has always welcomed partnership working. Some of the earliest photographs that we have at St George's Crypt are of nurses visiting the crypt to provide the essential medical support to those accessing our services. Photos also show the volunteers who are willing to provide the practical help. And a lot of the photos we have demonstrate the generosity of the people of Leeds by providing the essentials to be able to facilitate the basic needs of hospitality, which continues still today. And this obviously continues straight through the pandemic, even though we couldn't sort of accept volunteers within the building as such and things to stop the spread of COVID. We still have people donating things and clothes and food and everything else to sort of support the people in Leeds that needed it the most. For the Crypt, partnership working is essential to ensure that our mission statement and our ethos is fulfilled. And I've got an extract from our mission statement now. Our ethos is expressed in the way we work together as a community of faith, and by the way we relate to partner organisations and all people of goodwill who share our concern for the poor and excluded and want to work with us. In all our relationships, we seek to show respect and integrity to demonstrate and authenticate our ethos. The parable of the Good Samaritan is really lived out in the provision of the support that we deliver. Most people know about the Good Samaritan, but the Good Samaritan parable wasn't just one person, it was a team effort. There were other people involved in supporting this gentleman that was beaten up and left for dead on the side of the road. And there are many services and agencies out there who provide a compassionate support service to those who they feel driven to help with, and we're all in this together. It's not just a one service thing, it's that everybody together coming into Leeds. And this way of working was developed even more on the 25th of March 2020, when the government began the everybody in policy as a result of the COVID-19 pandemic. This is a day that's very much ingrained in my mind, as it was a day we moved 36 of our residents to more COVID-secure accommodation in the form of hotels. It was also the most successful day for positive move-ons for us in the history of the crypt in one day. It was also a time when our journey into supporting those through the pandemic began. There was a lot to process. It was a lot to sort of deal with and sort of get in place. An exodus of residents moving into a location that really didn't know what was going to hit it. We had a lot of things to sort out, a lot of sort of difficulties and challenges to sort out on the way. But within 24 hours, we had a food provision set up. Systems were in place to track the support of those booked into this accommodation, and support networks set up to help residents settle into the accommodation provided. This was all done in collaboration with our partners that had to work even more closely together, whilst obviously following social distancing and wearing PPE. But we had to sort of bring everything together. I've got some examples of partnership working, and there was a lot going on behind the scenes really as such that people probably weren't aware of. But together with partners, Leeds City Council, St Anne's that are here today, and other services around Leeds, we actually had to educate the client group about the dangers of COVID and that we were in a pandemic. So obviously our visual sort of side of stuff of wearing masks and social distancing played a big part in regards to the residents sort of adopting that within the things that they do. We also provided a wraparound support requiring accommodating up to 120 clients in one space. So we had to make sure that all the wraparound services there, the specialist support was in place. We provided support to help get medication delivered due to those isolating because of their vulnerabilities. Obviously they couldn't go out to the chemist to get things, they had to isolate and stay indoors. We worked very closely with other partner agencies to make sure that we can get medication delivered to the hotels. Support staff were redeployed from other commissioned services to help people settle in their new accommodation. The provision of vaccinations for the staff, which came at an essential time and boosted staff morale and helped to disperse fear. The provisions of on-site vaccinations for the residents, which was a big thing really, and we had a really good uptake of the residents accepting the vaccinations. The sharing of knowledge to help manage the spread of the virus with our team and client base. We had a lot of input from infection control, which helped design the policies and procedures really such as keep everybody safe. And I can tell you that no one died of COVID that we supported. And we actually stayed COVID clear until the variant changed to a less aggressive variant as well. So through all the systems that we put in place, we sort of managed to keep people safe. We also, at the hotel, we also had people referred to us with COVID, which was quite interesting. We had to sort of let them through the back door and put systems in place where all the doors were open and they couldn't hold any of the handles and things, and we actually sort of get them into the building. Provision for food for the residents as well, which was a key thing. Providing Christmas presents for the residents. Provision of distraction activities for those required to isolate. The provision of PPE to the staff and the residents. Provision of on-site medical support to the residents. Provision of move-on options for those in this accommodation. And the accessing of funding that support that could be delivered. And obviously sharing of resources and other best practice with each other. One of the key ones for me was basically supporting each other by sharing the fear and sharing the difficulties, sharing the sadness, sharing the tears, the joy, and most importantly, the sharing the fun of delivering a service together in a situation where it was most needed. In the 18 months or so that we were running this thing, we had 5 years worth of challenges thrown at us, and Leeds rose to the challenge, and we rose to it together. I've got some sort of stats for you really as such, and in the period of the everybody in, St George's Crypt was involved in providing 31,500 nights of emergency accommodation with 1,700 check-ins of people accessing that accommodation. I'm aware there are lots of other things going on in Leeds to provide accommodation. It wasn't just us doing stuff. I know Simon on the Streets did other things, and there were other hotels across Leeds that the council managed to get. But obviously through this crisis and things, this is what I'm aware of that we provided. And the stats obviously would be higher than what we provided as well. And we couldn't have done this alone without the support from others. And speaking to the staff and sort of listening to the staff, in a strange sort of way, we missed the chaos. We missed the chaos of having 120 people in one place at one time, delivering support daily to the people and things like that. And the staff often share stories about the experiences, and it was definitely a character building and colourful time. A lot can be learned from this time with this joint working. We've had more of an insight to the pressures and difficulties that other agencies face within their roles and the challenge of the ever-changing complexities of the group of people we support. From my perspective, it's created more respect from what other services do. It's helped understand what other services can provide and develop the collaborative working that's essential to support those who access our services that the Crypt provides, which will help improve the support going forwards. COVID hasn't gone away, and it will probably be something that we're all required to live with and manage. On the horizon is the cost of living that we will most likely see be the next crisis that we have to face. And basically from the Crypt, the pandemic also ruined our birthday. In this period we reached a ripe old age of 90, and we had a lot of celebrating planned that didn't happen. But when the restrictions relaxed, we had a blue Civic Trust plaque put on our wall outside the Crypt to commemorate the 90 years of service to Leeds, with a comment saying, "To be found where the battle is hottest and the work is hardest," something that we in Leeds demonstrated throughout this difficult period.